So good afternoon and welcome to HCRF Talks COVID with Dr. Platanias. This is session 18 with Dr. Platanias, and we're so thankful to have him back to help us address the latest news about COVID and, of course, talk about the promising potential of the COVID vaccine. So we also have a special guest joining us today. It's Dr. Angela Christine Argento. She is an assistant professor of medicine and thoracic surgery and the director of the Interventional Pulmonary Fellowship Program at Northwestern Feinberg School of Medicine. I don't know if everyone remembers, but she joined us during the summertime when COVID times were really, really daunting. She talked to us about how she was seeing a lot of young patients with COVID that had no underlying issues. One thing that stuck with me is she basically told us that we probably won't be hugging or kissing people for 5 years. So it'll be really interesting to get her perspective today about if we've, made some progress and, talking to Dr. Platanias about that. So I also want to thank HCRF and board members for being here, Eleni for being here. We're all here because we still care about cancer patients. There's a lot going on for all of us with COVID, but we are here because we want to make a difference for cancer patients. Dr. Platanias, I have a question that someone brought up through email today. It's, of course, what's on everyone's mind is the COVID vaccine. And the question is it possible for someone to be vaccinated for COVID, but still carry COVID and pass it on to somebody, but they themselves not develop it?
So the answer to this is that we don't know. And that's exactly why the recommendation is right now that whoever gets the vaccine needs to continue with precautions like before. In fact, Dr. Fauci was yesterday on the news on CNN, and he was asked exactly about that. And he said the same thing, that, we don't know if, you may be immune to the virus, but the virus still can enter you, stay in the nasopharynx, and although you don't get sick yourself, you could infect others. So that's one possibility. So we don't know yet, but
you see that,
theoretically it is possible.
So when you say that, what that means is you get vaccinated, you could develop immunity against it. So you yourself are protected, but you could become a carrier and potentially pass it on to somebody, right? So
yeah. And there is a good reason for that. The way you develop immunity, you develop antibodies, right? Proteins that go and block the virus. There are two types of antibodies. One is called IgG, and that's what circulates in our blood, right? And that's what people have been measuring when all the studies are measuring these antibodies, IgG, and we know that they are produced in high levels and can protect. Now, there is another type of antibodies called IgA that are in local tissues, and that's the entry of the virus. It's like the guards at the entry. And nobody has measured that in the trial so far. So nobody knows if they're, most likely they will be induced, but it could be that they are not. And in that case, you can get your virus, let's say, in your nose and your mouth, and can be there, but be stopped later, so it cannot cause disease. But then you could still give it to others. That's something that needs to be settled. There are studies right now, and they measure virus and all these things in people who got the vaccine. But so far, the answer is we don't know. And we have to be extremely careful because, this is a very deadly pandemic. And so for now, people like Eleni, who just got, and she's going to talk about it, her vaccine on Monday, and, still have to wear masks and keep social distancing and all that stuff,
Now, do you honestly want me to talk about the vaccine that I got Monday?
how was your?
Please do, yes.
Oh my God. I received the Moderna vaccine at Northwestern, and I was sick until yesterday.
Oh.
My arm is still hurting me. I got severe headaches, severe back pains. I was really sick. I was really sick, and this was the first vaccination. So I asked Dr. Platanias, I said, Dr. Platanias, I got so sick with the first one that I'm terrified to go take the second one because they say the second one is worse. And he's like, no, you have to take it. I go, I don't know about that. So it was a very awkward feeling, I want to say. It was a scary feeling in the beginning because I didn't want to do it. I just didn't feel comfortable in doing it. That's the honest truth. But I think I was Dr. Argento's, who's not right now. And Dr. Platanias kind of convinced me that I had to do it. So I'm not going to say more than that.
No, say more.
No, it's just a very scary. I started getting severe headaches and the back pain. The headaches were going down my back, the back of my neck and down my back. And, they were getting worse. I did take Tylenol, but, it scared me. There's a fear of what did I put in my body that's reacting like this.
And
But
then you take
they-
Tylenol before or anything?
yes, I took Tylenol. I kept taking Tylenol every 6 hours. And the only thing that's left now is just, pain in my arm. But my headaches went away, my back pain went away. But it was a scary experience, though, I have to admit.
Well, thank you for sharing that with us.
So
Hi,
don't
Dr.
be afraid. Go take it, take it, take it, take it. I'm gonna
I
exactly.
had it last week. I took it last week. And I only had my arm hurt a day and that was it.
Yeah, I don't know. Dr. Platanias, I forgot to ask you. You took the Pfizer. I took the Moderna.
Mhm.
Did you have any symptoms with the Pfizer?
No, I
It's-
just had minor pain in the first dose, and in the second dose, I had a little bit more tenderness again, and so
Did anyone
so I
else
did. I had
take
very
the
mild.
Moderna?
Huh?
Did anyone else though take the Moderna so we can just kind of
I
compare?
took mine was the Moderna.
And you didn't have any of this?
My arm hurt for one day and I exercised the next day. I felt fine.
So I know other people who took the Pfizer also. I know a doctor who had a more severe reaction. Maybe he had fever and felt sick. But so there are different. But everybody recovers, then it's fine.
Oh,
Nobody
yeah.
has
Today,
gotten
fine,
really
besides-
sick.
Yeah,
I mean,
besides
some
what-
people. Yeah. So it's not. There are some people who react more, but overall, it's a very safe vaccine. It doesn't. It goes away. Just you may feel bad, but the next day, like you, Eleni, right now, you look great. You don't.
Today I feel great. Only just a little
Yeah.
bit of pain, just a little bit of soreness, which is fine. But I feel great because I don't have the headaches. I don't have the
Mhm.
back pain. It was just a very weird feeling, I want to say. But I think Dr. Argento's just got on. Dr.
Hi.
Argento, I can't see you.
Nice to see you. Hi.
Dr. Argento, I was just telling everybody how we met you in the summertime and you joined us during some really daunting times. You talked about the COVID patients that were young, that were dying. And I mentioned to everyone, I remember you saying, we're not going to kiss and hug each other for another 5 years. And, so today I really, I think today marks the day of optimism. It marks the day of optimism because we're hearing people are getting vaccinated. Dr. Platanias Eleni got vaccinated. And I would love to hear about your perspective, if what is the same, what is different from when we last talked to you.
Yeah, I think I feel like that was forever ago. It's crazy how time kind of passes quickly, but also seems like so much time has passed in the interim. I also had my vaccine. After my first dose, I had a little bit of soreness in my arm. After my second dose, I definitely had more symptoms. So I had kind of fevers and chills, a lot of fatigue, headache for a couple of days. So 2 days for me. And then I felt totally fine. So for me, I would say it's absolutely worth getting the vaccine. I know when I met you the other night and Eleni, you know, I really pushed Eleni to get the vaccine. So sorry, Eleni, that you had some bad side effects.
I forgive you. Because I
But
love
it's worth it. It's worth it, right? You don't want COVID. We've been our numbers have come down some in the ICU. And overall in the hospital here. But what we notice now is it seems there's definitely optimism, I think, around the vaccine. I'm really, happy to say that most people seem willing to take it, even if they're a bit nervous. And I think this is the only way we're going to get back to some sort of normalcy, which is I think what we're all looking to do, right? Nobody wants to be in their homes anymore. Nobody wants to wear masks anymore. But, for the moment, and until we get hit a good amount of people who are vaccinated, we still have to do these things, right? So just because you're vaccinated doesn't mean you shouldn't wear a mask anymore, and doesn't mean that you should be meeting with large groups of people, things like that. So yeah. You look disappointed, Eleni.
Dr. Argentos, you convinced me because of something that you said about your ICU patients that you had. Can you please share with everyone, why is it that you had a lot of young people at ICU?
We don't fully understand it yet. There are we know that if you have certain underlying conditions, that if you're chronically ill or immune suppressed, that certainly you're higher risk. But then we see these young patients who also get just severely ill, and they may not have any underlying condition. Most of them are obese. I will say they're at least overweight or obese. And why that contributes, we're not exactly sure. We know that, or we think it has something to do with the inflammation within their system that makes them more prone to have severe effects from the virus. But it's scary to think that somebody who has no medical conditions can get COVID and be on full life support and die from this virus. Like, it's just, it's heartbreaking. And I guess it's hard. Like, I guess when we spoke, I think the thing that was, there's always this disconnect, I think, between the people who work in the hospital, especially those those of us who work in the intensive care unit, where we're seeing all these people who are so severely ill. And we see these effects of COVID, whereas the rest of the population doesn't really see that. You look outside, everything looks normal. You see your friends or your family, or you talk to them over Zoom, and everything seems okay. But we're not allowed to show you what's in the intensive care unit. You can't come and visit people that you would know in there, so you don't really see how sick they are. And that is really hard, because it's so hard to put into words what we're seeing, how sick these patients are, and they're sick for months. It's not just a couple of days like we're used to seeing in the ICU, where the turnaround is fast. You get a bad pneumonia, we give you antibiotics, a few days later you're feeling better, you're not requiring life support, and off you go. Now we're seeing these patients that are there for weeks or even months in the ICU. And it's just, it's hard.
And if I may add, this is so much worse than the flu. The flu also kills some people, but this is so much worse. There is no comparison. And it does so much damage in so many ways. It clots the blood. We have already had transplants of several people at Northwestern, lung transplants on young people.
Correct.
And as Christine said, nobody knows exactly what predisposes. Obesity makes things higher risk. But there have been also some young people who died who were not obese. Correct. One example that was terrible was a doctor, a 27-year-old woman who was an gynecology resident, who was exposed. He had, exposed and died, And probably may have to do with the virus load that you get. Some doctors get more than others. But there are also some other factors that we don't understand well. The immune system of some people, something else that we are missing yet. So it's an extremely dangerous virus,
Right. It can also affect your heart. So you can end up with heart failure. There's neurologic issues sometimes. So some people end up with really bad balance afterwards, where they have trouble walking and sort of keeping things straight. There's this fog that people describe later, that it seems like their mind is not clear after having the virus for several months afterwards. It's really no joke. It's very, very different than the flu. And so that comparison initially that was given between the flu and COVID is not really accurate.
Dr. Argento, can you explain? I'm sorry, Nicole.
Okay,
Can
that's
you explain to us? I know you guys made history in Northwestern, and your team especially, that you did the first double lung transplant in the country on
Right.
a COVID patient.
Correct.
Can you
Yeah.
explain to us how that process went, and especially knowing that this young person had COVID?
Yeah, so she was a young woman, and she was actually in the ICU. She was on heart-lung bypass, so you can't be on any more life support than what she was on. So not just on a ventilator. She was on medicine to maintain her blood pressure, and she was on a complete heart-lung bypass machine. So you can't get any more support than that. You can't get any sicker than that. And she was on that machine for several weeks, actually. And so when you look at her, she was in her 20s, and she didn't have any underlying lung conditions. And so we sat there and said, what can we do? Is it crazy to consider a lung transplant for her? And, at the time we really didn't know, but it was really a multidisciplinary discussion. So between the thoracic surgeons, the ICU team, the pulmonary people, critical care, anesthesia, just sort of everybody got involved to try and say, is this insane or is this genius? And to be fair, we didn't really know. We were hoping that we would be as safe as possible, and having a lot of heads sort of in her game would work. And she did amazing. And I don't know how many of you have seen some of the press conferences and such, but she's done extremely well, and is doing wonderful. And when they took out her lungs, there's actually, in the publication about it, there's pictures of her lungs, and they're completely destroyed. So I think she wouldn't have had another option. She wouldn't have been able to come off life support without it. And so that was a real win. And that was a game changer, I think, for the world. So now we're getting people actually transferred in and whatnot to Northwestern to try and do lung transplants for them. And then our team has sort of talked to other institutions and taught them how to accomplish this, and do well. And so it's now other places are also doing lung transplant for COVID patients. So it's really interesting.
Congratulations, you are geniuses. Whole team,
Not me.
your team, you're all geniuses for making this decision.
That's really so. What makes a candidate eligible for a lung transplant? Was that just more of a clinical trial thing, or what?
So it wasn't a clinical trial. This was really, a decision where the whole treatment team sort of came together and decided, is there anything else we can do for her? And this was sort of her last chance. It was almost like a Hail Mary, right? Where you sit there and say, we don't have anything else to offer her. And so we spoke extensively with her family. We didn't know if, this was going to work or not. And they said, she doesn't have really any other options. So let's try, right? And it worked, and we were very lucky, and everyone was sort of on pins and needles until we knew she got through it. But she did really well. So
amazing.
Yeah.
Dr. Argento, thank you for joining us. As a thoracic surgeon, you're critically important and very august. I'm not saying you're as important as august as Dr. Platanias, but who is?
I'm definitely not as important as Dr. Platanias.
You know Dr. Penn Faber.
I've heard of him.
He did some handiwork on me. He doesn't operate anymore. I think he's in his early 70s.
Mhm.
I wanted to get your take on a few things. And
Okay.
one of the things, by the way, that makes you so important is the patients who you treat.
Mhm.
And
For sure.
so, we need to keep you healthy and keep you practicing for many years.
Thank you.
So Elaine had some pretty bad side effects, and I talked to 5 people in Massachusetts earlier this week, 2 of whom got the Pfizer and 3 of whom got Moderna. The Pfizer, and the 2 Pfizer people had both rounds, no side effects other than a sore arm. 2 of the Moderna people just had 1 round, and unfortunately, he had what sounds like a pretty similar experience to Laney. The third one, we had no major symptoms at all. So do we have any data now on the rate of incidence of side effects for those 2 vaccines, how they compare, what the side effects are? And then do we know, we've heard many people say that the second dose is the one that really pours on the side effects. Any difference between Pfizer and Moderna on that? And so for somebody like Eleni, who had more side effects than we would want her to have, does that mean that the probability is she's already had her side effects, so the second round for her is going to be a walk in the park?
No,
Not necessarily.
not at all. Yeah.
I'm trying, Eleni.
I don't think, the reports have been, as Dr. Platanias was saying earlier, they've been really varied with both of the vaccines. So some people have minimal symptoms, other people have more symptoms. And you can't really tell who's going to get symptoms and who's going to be just fine. And also with the kind of the first and second dose, typically the second dose, you get a more exuberant response. So most people will have the effects a little bit worse after the second dose. But that's not universal. And I had one of our nurses actually had more effects from the first dose than from the second dose. So hopefully Eleni will fall in that category. But I would say most often you have more side effects from the second dose. But as Dr. Platania said, there's no live virus in that vaccine. So it is safe. It doesn't make you feel great, but that sort of, I don't know, in my simpleton brain, sometimes I think about how, my body is learning to react to these things and the vaccine is working. And that's a good thing. And so hopefully, if you have a side effect, if you do not feel great, then hopefully that means that if you do come into contact with COVID, that your body will have as robust a response and hopefully fight it off without you actually getting sick. But nobody knows that either, to be fair. Like nobody knows that if you don't get a bad side effect, that you're not going to have a robust response. I think you can have immunity the same. So don't be worried if you don't get a robust response. I'm just saying it's not the end of the world if you do have some of the side effects. It's really known, and they sometimes last 2 to 3 days. And most of the time, almost everybody feels completely back to normal after a few days.
So is it similar to, like chemo, it's a buildup? Why the second shot is basically?
We think so. Because that's your booster, so to speak.
Any comparative data on effectiveness or side effects between Pfizer and Moderna?
They're 94% and 95% effective based on the studies. So 94% for Moderna, 95% for Pfizer, which is not clinically, it's not significantly different. So we would say that they're equally effective.
But nobody has compared them in parallel in a clinical study. So these numbers are pretty similar, so.
Exactly.
And both vaccines use the same technology, this innovative technology for the RNA. So.
Yeah.
All right, so this is the big question, my big question of the day. Because I've heard some doctors express some concerns about antibody dependence enhancement. What do we know about that?
What do you mean antibody dependent enhancement? Like what? In what
That
for what?
by taking the vaccine, that somehow that facilitates entrance of the virus.
Oh no.
I think he's
No.
referring
Oh,
to
please.
pathogenic priming. Somebody mentioned something about pathogenic priming. I think that's what he's referring to.
I don't, Christine, if you want to answer first, but no question, this is not the case at all. I mean, there is nothing like this. There are some people who make things up and create theories there without zero evidence. That's not based on any facts. Christine, correct me if I'm wrong.
No, exactly what I would say. Yeah. There's no live virus there. You cannot get sick from the virus. You'll just have some side effects from the vaccine, but you will not get COVID from the virus. You will not get primed. None of that.
I mean, the antibodies, whoever said that, it sounds like they meant that the antibodies may prime the entry of the virus, which
No.
is incoherent. That doesn't make any sense. If you know the science, the antibodies will never prime a virus to entry. They only do the opposite, they stop it. So
Correct.
I don't know who said that and what is exactly what they said, but this is not
Doesn't make
makes no
sense.
sense.
I can't remember
And
her
there are
name, but she
many
was an
people-
attractive doctor.
Well, that doesn't make it more correct.
No.
Another fact. There are other people who are saying that
I
because
just
it's an
got kicked
RNA
by my wife.
So, but also there were these theories at the beginning, because again, it's conspiracy stuff, that because it's RNA virus, it will enter your DNA. Doesn't
Oh,
make
yeah.
any sense at all. It was nothing like scientifically, and just people throw names there, and if you don't know if it is, you see it as, but there is nothing like that. I will ignore that.
I was so proud I came up with ADE. So for people like me, and I fall in the category of being a coward. And so, and most men, I mean, let's face it, that's why men don't have babies. We have no population. We have very low threshold.
Now you know why we love Scott. Now you know why we love him. He speaks the truth.
But let me ask a hypothetical question. Some chicken goes in, gets the Pfizer vaccine, gets no reaction to it, and decides, you know what? Maybe I didn't get 95% immunity, but I've got 50% immunity approximately. And we don't really know how effective these vaccines will be. So far, it seems to be pretty effective against the UK strain. But, the Brazilian or the South African strain seems to be presenting a problem. So even, similar to the flu, even if we get the vaccine, this thing is evolving. And I hate to say this, and I exclude a few doctors, but so far, the viruses can be always a step or two ahead of the medicine.
For sure. And that's, that's partly why you don't want to just stop masking. You don't want to start getting in, to big groups again and sort of completely back to normal just yet, is we don't know. We know that now that there are several different strains. It started out, back in February, March, we had just a single strain. And then there came the UK and the South African, all this stuff, and the Brazilians. And so, it is evolving, just like the flu evolves, just like other viruses evolve. And we don't know yet if the vaccine is going to be good against one or all of them. If you need a different vaccine that they're going to have to develop, nobody knows just yet.
Christina,
Actually, yeah.
Can
May
I-
I just add? I just want to add to Scott's before we move. There have been studies that showed very recent, not very big, but clearly showed that the UK strain, the response was 90%, almost like anything else. There was a very small study that was just reported, I think today, for the South African strain that showed 50%.
So I didn't see that yet.
Yeah, it just came out the last few hours. And that one shows that this strain is probably less responsive to the vaccines. But Moderna had already said that they will try to put a patch, like give a third, dose that will be designed to try to include that strain. So there is things, so we may end up, if the South African and Brazilian strains that are the two similar ones that seem to be less responsive, if they keep expanding, we may end up with a third dose for everyone who will get the vaccine,
Can I ask you a question, please, both of you? Minister Boris of England said that they're trying to vaccinate all their people with one vaccine because there's a shortage of vaccines all over the world. And he said on the news that if we are able to vaccinate our entire people with the one vaccine, we will be lucky. What do you think of that? Do you think that they will be protected, although they will be getting just the one vaccine? And why aren't we doing the same thing in our country where we do have a shortage to vaccinate the entire country with at least one vaccine?
Christine, do you want to go first or go?
No, do you?
Either way, yeah.
That's what he said to use. I mean, he said that it's very important because of all the strands right now, because there's a complete shutdown in England. No one can go anywhere.
I mean, the first part is, that our FDA, the requirements are a little bit more stringent than what they generally have in Europe and in England. And so we do things a little bit more stringently than there. And so I think we follow sort of those regulations a little bit closer. So that's one thing. I don't know, Dr. Platanias, I would say that probably just a single dose, it would be less effective, but I don't know the exact, I don't have numbers to back me up. I don't know.
So nobody knows, but I think what they're doing in England is very reasonable under the circumstances. And I think is a different approach that may prove to be more effective because this is like, it may be able to spread the immunity faster in the population. In the US, there has been a decision not to do that. Nobody knows if it is right or wrong, but it's based on traditional approach. You go with what the data are. But the UK may be doing the right thing. Nobody knows this moment. There is a third vaccine that people are waiting now for the data. There is a single dose, yes, and that may be something else, if there are more vaccines that will come in play.
Yeah, well, there's a couple of those, right? So one of them has shown to be less effective, only 50 or 60%. And then the other one that looks like it will be as effective with a single dose. And so, I guess we just don't know. These vaccines, the Moderna and the Pfizer, were not tested as a single dose. So I think we just don't know if a single dose would. It would at least be partially.
If you look carefully at the data, the single dose they said is 50%, but it's not. But it's probably more. The 50% was if you look at the day that the second, it was a comparison. Like the 50% was taking into account people who had been infected from before.
Correct.
And so in reality, we don't know between the days 14 and 21, that's where you see the difference. But we don't know. Maybe if you look at what was happening, the curves, I should show the figure here, but it's pretty flat. It's just that we were stopping at day 21 because after that day they get the second dose. So it's very hard to follow, but I think it's probably more than 50% just with the first dose, but we don't know for sure.
Can I ask a question?
The goal is to get to herd immunity. Then you reach herd immunity quicker by giving more of the population the one dose, even if it's 50%. than if you give a smaller percentage both doses?
That's the UK approach. That's exactly what they're doing. And some people have suggested that this may be a reasonable thing to do here too. I think so too, actually, but it won't happen. I mean,
It will never.
it has been decided it will not happen. I personally think probably I will agree with something like this, because we see now what's happening. They send the vaccine, and then the states are holding large doses because they want to make sure they will get the second dose.
Mhm.
And all these things, because there was no good planning for the second dose to go there, and all these things now keep delaying stuff. In the meantime, more victims, more people
With
get
the,
affected.
With
So
the
Boris
employment-
Johnson, Minister Boris Johnson, he hit it right on the head when he said, I would rather vaccinate all my people with one vaccine. And now you're saying that it covers them 50%, where the flu shot covers you only 20%. So he's using a wiser method to protect all these people from dying. And why isn't it that we cannot do that? And just to, vaccinate everyone, our entire country, and we can go on and live in our normal lives, yes, with masks and so on until everyone is vaccinated, to get our country going. Why we don't follow that regiment?
I think Israel did the same thing.
All of Europe.
and they're all vaccinated.
Yeah, I would say that Europe, Canada is probably going to follow suit. The US, again, like I think they tend to follow more what the FDA regulations say, and they're certainly a lot more stringent than what they have in Europe, as and so they specify, you should get your 2 doses at strict, 21 days or 28 days apart. And so
But
I'm
what if
guessing.
But if you think
What
about
if you
it,
don't? What if you don't take the second one? Are you at risk for anything? If you
No,
decide
but-
you don't want to take it, you want to give it up for someone else to take it, since there is a shortage.
Yeah, I mean, I think we don't know. That's the whole point, is we don't know if that makes you less immune, to COVID. So are you risking being only 50% immune versus being 95% immune?
so
And I
2
think you
questions
also
on
have
that.
to- Sorry, I was just going to follow up on that. I think you have to take into account the window of opportunity too, right? So, Eleni, you took the first shot. After 2 or 3 months, you're not going to just have a booster. You're going to have to redo both shots again to get up to that 90%, right?
Right.
No, that's not true.
I don't think so. You should still
if
get
you
it.
take it and you take it 3 months later, you only need one second shot.
Oh, what
There's no
about a
reason
year
to
later?
believe you need again 2 shots.
What about a year later?
Huh?
Dr. Platanias?
Nobody knows. No, nobody
I don't
knows.
know.
That
Maybe,
we need
maybe
more
not.
data.
Okay.
Yeah.
It's
But it
too
would
new.
seem to
Yeah.
make sense that if you did it the way Boris is doing it, number one, we're losing some of the vaccine because of spoilage due to the freezing requirements, which may not be the case with the subsequent vaccines. Number
Yeah.
2, you're getting everybody the first dose. Then, even though the booster is delayed, by the time people get the booster, maybe it's adjusted to account for other strands. And isn't stating that something is 50% effective, understating it if, let's say, for example, you're wearing one mask, or as Dr. Lampera suggested, 2.
Mhm. Yeah, certainly. I mean, certainly, I agree with Dr. Platanias. I think it's reasonable, to have just I like their approach, but I'm also Canadian, so I feel like I'm sort of biased towards that that approach. But yeah, and wearing 2 masks, they do say, can help because you've got, it's sort of tighter to your face. So the COVID would have to go through more of a maze to kind of get in and infect you.
Well, I
And they
think we
think that
should-
sometimes it's the amount of virus that has to come into contact with you that will cause, disease, whether you get COVID or not. And so that's why some people are suggesting 2 masks.
I wear 2 masks all the time. I wear a KN95, something like that, and on top of that, a surgical mask. And I strongly recommend that to everyone. I mean, most doctors do that. Not most doctors, many.
Many.
But yeah, especially if you are in a risk environment.
And it can be even like a surgical mask and a cloth mask, or even two cloth
Masks are
masks.
extremely important.
Yeah.
Yes.
So I'll jump in with
Yeah.
a question.
Two cloth masks are definitely better than the important thing is that everyone needs to be wearing a mask to have a protective environment. If you have people who don't wear masks, then you need a much better mask yourself. You know, that's the problem.
Yeah.
You need, so in a situation that everyone wears a surgical mask, that's great.
Yeah.
But the problem is that unfortunately in this country, there are a few people who disregard, the need for masks, and they're very selfish, and they are a threat to everyone with what they do. So,
And ideally, you want to think about just trying to make that mask actually fit your face. So it has to be over your nose and your mouth, but it also should be tighter across your face, not really loose with lots of gaps, letting air in and out. So that's really important.
Well, what if we take a vote on changing the protocol, and then Dr. Platanias can call Dr. Fauci and make it happen?
Sounds good to
Well,
me.
I mean, what's incredible is that we've got 2 vaccines already, with 2 more on the way and some lagging behind that. So I think this is really a case where a great scientist, helped by, cogent government officials, have really given us all a chance to whip this thing.
Mhm.
You have a
It's
question?
Yeah, did somebody else have a question, I thought?
I think.
I actually have one. It's Felisa. Hi, everyone. So I'm actually asking on behalf of my sister-in-law. She's a teacher, so she falls under the 1B tier where she's eligible for vaccination now. She's actually 8 months pregnant. And so I know being pregnant, that demographic was omitted from the clinical study for obvious reasons. So I just wanted to hear Dr. Argento and Dr. Platanias give like a 2-minute little opinion piece about what they would tell her. She's obviously spoken to her OBGYN, but I just wanted to hear if you had any advice or opinion one way or the other, what you would say.
I have not reviewed the literature for the pregnancy with the vaccine, but I will tell you that I have 3 colleagues who are currently pregnant. And they're sort of in different stages of pregnancy. So one is just entering her second trimester, one is sort of at the end of her second trimester, and one is about to pop. And all 3 of them ended up sort of reviewing all the literature and ended up getting the vaccines, feeling safe with them. So although I did not review it myself, I will tell you that 3 people that I think are extremely diligent really did go through it and have all decided to go forward.
And I agree. I mean, I don't think there are a lot of data. There are very minimal data.
Very minimal.
But there is no reason to believe that pregnancy will be more risky. So I think she should absolutely take it. I mean, that's what I would do.
Right.
That's what her OBGYN suggested too. I just wanted 2 professional.
Confirmation.
Well, there you go.
Would your answer be different if it was an in-home birth as opposed to going to the hospital?
No. Nope. I would still take it.
There's a question in the chat from somebody. So suppose there's a 40-year-old male having removed his spleen and gallbladder, having spherocytosis and being allergic to penicillin. Is it safe to be vaccinated?
Yes, it should still be safe to be vaccinated.
There's no reason, nothing. Yeah.
Can we just talk about COVID immunity for a second? I've had a few people say to
Hello? I'm frozen.
Can you hear Dr. Platanias? So
sorry. Yeah, I can hear now.
So I've heard
Hello?
people, I've heard people say that, oh, I had COVID and at least for 3 months I should be fine. I should have antibodies so I can, go do whatever I want. And recently I read that 1/3 of recovered COVID patients return to the hospital in 5 months and 1/8 die. So what is your thoughts about people feeling more free because they've had COVID? How long do those antibodies last? And is there any truth to that?
I personally think people who had COVID have to be very careful because there are some long-term toxicity sometimes, but also because you can get reinfected. There are data of second COVID cases. So I think they should take all precautions like if they did not have COVID. The vaccine, you don't get the vaccine if you had COVID. For the recommendation, I think is 90 days. You have to wait 90 days. But at that point, you should consider taking the vaccine again because you can get infected again. So
Yeah. And it's not even just with COVID that you can get reinfected. We actually published a paper from my group that talks about patients who have COVID, and roughly 30% of patients had another infection at the same time. So your immune system is sort of prone to getting infections while you have COVID too. So you want to think that you're not just completely safe. And so regardless of whether you had COVID, you should not feel free to just go about willy-nilly and not wear a mask and not take regular precautions.
And
I'm so glad you asked that question, Nicole, because I know you and I discussed it a couple weekends ago. There are so many individuals that I know who've had COVID, and their doctors have told them that they're immune for 90 days, which I couldn't believe.
Yeah, that seems crazy.
Well, it appears that it makes the body weaken to let it open to other things.
And we don't have like clear data about, the immunity. We know that you'll develop some antibodies, but it seems to vary also person to person. The antibodies that you develop immediately after you get COVID, so how long they last might depend on the individual. We just don't know.
Yeah, I think George is right. We're further along in the epidemic, so we're meeting more and more people that had COVID. And it's funny because they're saying these things like, oh, for 3 months, I'm okay, right? And so, and maybe it's just misreading the CDC guidelines. Can you just kind of bring to light, why is it that if someone's have COVID, they should wait 90 days? What is it, what's the reason behind that?
I mean, I think it is because you should have some antibodies there already. So you don't necessarily need the vaccine, and then getting sort of 2 doses of the vaccine, and maybe we should be giving it to other people too, while you have immunity.
Thank you.
There was a question in the chat about fever from the vaccine and what should you do about it. You can take Tylenol or ibuprofen, and that seemed to work really well for everyone that I've spoken to. You don't seem to need more than that.
Is there any progress in treating COVID patients? I read somewhere that ivermectin, like a parasitic drug, seemed to be promising. Is there anything else that seems to be working more?
So right now, what we're using for patients who have severe COVID, so the ones that are in the intensive care unit, is really dexamethasone, which is a steroid. So it just dampens the immune response. And that seems to help people. Some of the other drugs, you've probably heard of remdesivir, that's used for sort of the moderate COVID patients. So the ones that get admitted to the hospital, but not the patients who go to ICU, and that will tend to lessen the duration of symptoms. So ideally, they won't have symptoms for as many days if they take remdesivir, a course of remdesivir. And so, but those are really the two therapies that we're using for the moment. Other things are in trial phase that we're starting, but the convalescent plasma we started using and then was shown not to really be helpful. Other things have not really proven to be terribly helpful so far.
As we get farther down, we're almost a year. Are you seeing less patients coming in that are seriously ill with COVID, or more that need to be on a ventilator, or less?
I feel like we certainly have less patients in the ICU than we did at the height of the pandemic, so kind of around May or June time frame. So we certainly have less than that. We still have, I don't know, between 30 and 40 patients in the ICU. Most of them are on ventilators or on the heart-lung bypass machines. What I do feel like, though, is that they are a bit more sick. So I feel like the severity of illness has gone up, but the number of patients has gone down.
Dr. Argento, do you want to just answer in the meantime?
Sure.
Are there any studies? You see the chat question, infertility.
Oh, sorry, I didn't see the one about
We're
infertility.
just asking, is there any studies looking at vaccines and fertility?
Not that I know of. No, for this particular vaccine, not that I know. I don't think so. So that I don't know. Why patients are getting more severe illness now than before, I don't really know the answer to that either. I don't know if it's because we've gotten a little bit better at sort of taking care of patients in that mild or moderate arena, and so we don't get them to the ICU until it's sort of later in their course. We used to kind of transfer patients to the ICU a little bit earlier, put them on ventilators a little bit earlier than we do now. We have a little bit more of a comfort level and sort of know how most COVID patients will react to giving them different forms of oxygen, whether that's by nasal cannula or face mask, or that high flow nasal cannula that you may have heard of, or a ventilator. And so I think we've gotten a little bit more comfortable. We're willing to play around a little bit more. And so the patients that end up coming to the ICU are really the critically ill ones, the ones that are more severe than they were at the beginning of the pandemic.
I'll share with you that I was shopping in a store, and there was a tall young man and girl behind me, and he had one of those silk masks on. And I had turned around, I said, you know, have you heard any information about you need to wear another mask on top of those silk masks? And his comment was, I'm not worried. I'm young, I'm healthy and strong. I can beat anything. You know,
Yeah.
so the attitude is still there.
Yeah. And it's just not true. I can't tell, and it's heartbreaking. Like, it's really hard for us because we're in the ICU, and these patients are sometimes dying and they can't even have their family members around. There's nobody around. It's like a ghost town in there. Usually it's really packed with family, and now it's just empty. And so the nurses try really hard to be there with the patients as much as possible. The doctors, we all try really hard.
5 o'clock.
But yeah, it's really, yeah, it's difficult seeing people, you know, be really sick and alone. And so I think everyone tries to chip in and do their best to make sure that everybody feels like they have somebody there for them, somebody there with them.
By the way, sorry, I was disconnected. I'm just
good. There you are. What were you going to say? It sounded so important.
I forgot now. I was trying to.
You know, Dr. Platanias is like E.F. Hutton. When Dr. Platanias speaks, everybody listens.
He's very powerful. That's why his mic broke.
I actually have an intelligent question because Charlene fed it to me. And that is, what recommendations are you giving to patients as far as vaccines and treatment for COVID if they are undergoing or have recently undergone either chemo, radioimmunotherapy, or radiation treatments?
That's a very good question. We don't, you know, the recommendation is for people to get the vaccine if they can, meaning if you are over 65. Now, people who get, so for cancer patients, there are not separate rules. Now, if someone gets a very immunosuppressive treatment, let's say a transplant or something like this, then the vaccines are unlikely to work, although they are not dangerous, but they are not contraindicated, you know. But it doesn't mean they will work well if you get some strong treatment at that point. So this is not happening to a great extent right now. And I will, if there is someone who can get the vaccine, we will recommend to take the vaccine. Unless the only exception is if they get some treatments that stimulate the immune system. I have not faced that yet, but probably that may be the only. There are these checkpoint inhibitors, some very strong treatments that stimulate the immune system. Then one has to think that a little more, because then, you know, the vaccine may make things react differently. But for regular chemotherapy, there is no contraindication. So.
Yeah, I think that's what most of the oncologists are saying. The other thing that came up for me this week in my clinic that might be helpful to you guys is people were talking about allergic reactions, and you know, if they have allergies to eggs or shellfish or whatever, you can still take the vaccine. But I do have one patient who's had several anaphylactic reactions to other vaccines, and not to just one, but to multiple. And by anaphylactic, I mean like their throat swells up and closes, so they have significant difficulty breathing. And in that case, you should be seen by an allergist before considering the COVID vaccine. So they are seeing a few patients who have really severe allergies before getting the COVID vaccine. Those patients should be seen by an allergist. Who
Are
can
they
deal with that.
medicated like with?
They are not, I'm not sure. When I spoke with one of my colleagues in allergy, she said that sometimes they can pre-medicate and get them through it. Otherwise, they can sort of give a very minimal dose of the vaccine to get your body sort of used to it. And so that it sort of desensitizes you to the vaccine, so that you don't end up with that specific response. So they do a few different things, and I don't know kind of why they would do one versus the other. But.
Well, one final suggestion for you, Doctor, and certainly for Dr. Platanias, it would be great if you became part of Cameo.
What's Cameo?
What's that?
It's Teddy's son's company, where all these celebrities, you pay a fee and they'll give you a personalized video.
Oh,
and I
cool.
think a lot of us we'd stand in line to get a personal message from Dr. Platanias.
I would. I would definitely.
Thank you. So,
anybody else? Any more questions? Well, if
What-
not, oh, Dr. Platanias, go ahead.
no, better. I was going to ask Scott something, but I better not. So.
No, go ahead.
No, you said you had the whole analysis for Dr. Fauci, and I was curious to see what you had.
I'll have Eleni get your email from her. I'll send it. It's just the statements over time and how many of them were wrong and many of them are inconsistent.
Nice.
As
I'm
you
not
know, we
saying he's
don't
a
agree
bad
on
guy.
that
I'm
at
just
all,
saying
Scott. We
he's
don't
no
agree.
Dr. Platanias.
What's that?
I'm not saying Dr. Fauci's a bad guy. In fact, he seems like a very nice man. He's just no Dr. Platanias. That's all.
Oh, no,
Dr. Argentos, we have.
Believe me, I
great
only wish. He's the best. He's the
Yeah.
best. And I
No, he's
thank you.
barred from Cameo.
He would probably rake it in Cameo. And I'm sorry that I came late. Unfortunately, my cases ran a little bit late today, so sorry about that.
We're going to lose Dr. Argentos. She's
True.
leaving Northwestern.
But I thought I was still part of this foundation.
You are part of the foundation. You're always going to be part of this foundation. What's wrong with you? And she
So you know,
promised
there's
she's coming back for all our events. And she might come back to Northwestern. Who knows? Maybe Dr. Platanias will convince her.
There you
Where
go.
the-
Try. I will do my best.
Where are you going?
Johns Hopkins. So I'll be in
No, that's a
Baltimore.
second-rate institution.
I know it.
See, now, Dr. Platanias, if you generate some Cameo revenue, we can increase what we can pay Dr. Argento.
Okay, we'll try. We'll do. We'll give it a shot.
That sounds awesome.
We're going to bring her back. We're going to bring her back.
I love it. Awesome.
Oh, so if we're both, everyone's wearing double masks and we get there's both shots, can we start kissing again?
I hope so eventually.
At some
Darlene, said
point.
no.
Oh,
But not yet.
gotcha. Okay. So Valentine's Day is out.
Maybe in 10
Yeah, Valentine's Day is out. It's all virtual Zoom kisses.
Okay. Better than nothing. At least we go on leave everybody on a good note.
There you go. I love it.
Well, Nicole, this is the time where you give us a brilliant wrap up.
Well, thank you. And I hope we can talk to Dr. Argento in the coming months, even though she's leaving. It's so
For sure.
valuable getting your perspective and insight. And thank you, Dr. Platanias, as always. We'll see everybody in 2 weeks, hopefully making more progress with the vaccine and better days ahead. So
Thank you.
everybody, thank you.
Thank you,
you.
everyone.
Bye-bye.
Everyone.
Thank you.
Bye.
Thank you
Bye.
very much.
Be safe. Thank you.
Bye.
You guys. Bye.